So, if you're planning to move to Panama, one of the biggest questions you probably have is, do I need health insurance? And if so, how much does it cost? As a nurse living here, I'm going to break that down, what expats really need to know about health insurance in Panama. So, stay tuned for that. So, there is a difference. One thing to understand right away: healthcare in Panama is much more affordable than in the US. Many routine visits are paid out of pocket because the cost is low. But insurance is still very important for major medical events like surgery, hospitalization, or emergencies. So they have two different systems here, the public and the private system. Let's start with the public system. So Panama has a public healthcare system. It's called the CSS. And you may qualify for this system if you're working for a Panamanian employer, or you're paying into the system, like taxes, for instance. The public system is very affordable, but, and that's a big but, wait times can be longer. Many expats prefer private care for convenience and the English speaking providers that comes with private care. Sometimes in public care, you won't have that option. So, with your private health insurance, typically the monthly ranges between, let's say, ages 30 to 40, 50 to $120 a month. Ages 40 to 55 may run about $100 to $200 a month. Ages 55 to 65 may run somewhere between 150 and $300 a month. Now, 65 and higher, it's limited. The options are more limited. So the factors that can affect your cost would be your age, pre-existing conditions, your coverage level, and the deductible amount that you choose. Many expats choose international or local private plans, so you have options of both. So, because care is affordable, some expats pay cash for routine care and carry insurance only for major medical. For example, a doctor visit is $20 to $50, a specialist visit may be $40 to $80, and a dental cleaning $40 to $70. So those are more affordable. But if you need hospitalization, surgery, or cancer treatment, insurance becomes very important. So I'd like to share a real life emergency situation that happened. It didn't actually happen to me, but it happened to a couple of mine that I've met here. I'll call them Jim and Tina. So they were doing routine things like riding a bike. We normally would ride, walk, do different activities. Well, this particular day, Jim was riding his bike and he ended up coming down on his bike the wrong way and tore a muscle in his forearm. This was a freak accident. It was not, he's a very young, healthy guy. So this happened. So we had to end up rushing him to the emergency room. We went to the emergency room. They looked at his arm, they did x rays, and it turns out that he needed to have major surgery to reattach that muscle. It broke from the top of his arm down to his elbow. So he had to be admitted in the hospital for several days. I want to say about three. He had major surgery. So he had a surgeon, he had anesthesia, he had rehab after all this. So, needless to say, um, he had to pay out of pocket for this whole procedure. And I want to say for everything, it was between $8,000 and $10,000 that he had to pay up front, which is not expensive considering he had a surgeon, he had a hospital room for 3 days, he had anesthesia, he had his follow-up care. All that was bulked into that one price. So imagine in the US, you would have that same procedure. You would have to pay however many thousands of dollars for your room. You pay separate for your the operating room, the OR. You pay separate for your doctor. You pay separate for your anesthesia. It does not come under that one bulk. So even though it's affordable, $8,000 to $10,000 is a lot of money to pay at one time. That is why having insurance is very important, so that if you don't, is or a emergency fund. If you have the money stacked up, that's well, but most people don't have that kind of money stacked up. So insurance becomes very, very important, especially in situations like this. Expats do, which most common approaches, they have used private local insurance, international expat insurance, a high deductible plan, plus cash for routine care. Some retirees self insure if financially able. As a nurse, I always recommend having protection for major medical events, even if you pay cash for everyday care. Are several hospitals in the area. One particular hospital that is affiliated with John Hopkins. Most of the hospitals here, the doctors are trained in the US or in Europe. So they are up to standard when it comes to care. My particular hospital that I chose is called Santa Fe Hospital. It's a mid-level hospital. They offer all of your ambulance. They offer all of the services, X-ray, surgery, CAT scans, all that. And so I have a plan that runs me about $230 a month. I've used my insurance once. I had a knee problem and I went and had x-rays done. When I went to get my x-ray, I had to get an order from my primary care doctor for the x-ray. I got my x-ray done. When I arrived there with my order, I was seen within 10 or 15 minutes. The cost of my x-ray was $7 with my insurance, and my results, I had my results on my phone before I actually left. They weren't red, just the pictures on my phone before I actually left the facility. And so in 2 days, I got the red results and was able to go to a specialist. Even under my specialist visit, I went to orthopedics. When I went to my orthopedic doctor, my visit was total $42. And so that was out of pocket. So what I'm saying is that it's very affordable here, but you do need your insurance. Okay. Panama offers excellent health care at a fraction of the US costs. But having the right insurance strategy gives you peace of mind. If you're considering a move, I'm sharing real health care costs and experience here in Panama. Please subscribe for full health care in Panama series. You thinking about moving to Panama? One of the biggest questions expats ask is about health insurance. So my goal here is to give you some resources to help you. In this video, I break down what expats really need to know about health insurance in Panama, including your private versus your public options, typical monthly costs, and whether you actually need insurance for everyday care. As a nurse living here in Panama, I share real information to help you make informed decisions before you move. Subscribe to Life Evolve with Michelle for real healthcare costs, expat life, and wellness abroad. Thank you so much for tuning in, and I hope to see you on the next video. Bye bye.